33 million seniors on Medicare Advantage are walking into 2026 expecting their healthcare to work exactly as it did last year. Instead, they are discovering that the private insurance market that they rely on is fracturing under invisible pressure. People are calling their dentist to schedule a crown, only to find the procedure is no longer covered. Gym memberships are vanishing, and the maximum amount a senior can be required to pay out of pocket has climbed up towards $6,000. For over 1 million people, the change is even more absolute. Insurers are exiting entire markets, leaving seniors to find out through the mail that their existing plans will simply cease to exist on January 1st. This spike in costs isn't confined to private plans. If you look at Part B here on your Medicare card, the part that covers doctor visits, the monthly premium rose 9.7%. This forces even those on traditional Medicare to pay more for the exact same access they had last year. These vanishing perks and rising premiums are the visible symptoms of a massive financial realignment. To see why your benefits are disappearing, we must look at the multi-billion-dollar profit engine insurers have run behind the scenes for years. To understand the current profit squeeze, we first have to look at how these plans get paid. The federal government does not pay your medical bills directly. Instead, it pays the private insurer a fixed monthly amount for every person enrolled in the plan. The size of that payment is determined by a risk score, a calculation of how sick a patient is expected to be. A healthy patient generates a baseline payment, but a patient documented with multiple chronic conditions generates a much higher monthly payment from the government to cover their expected care. Over time, insurers discovered they could drive revenue higher by documenting as many conditions as possible. By multiplying the number of diagnoses on paper, insurers made their members appear sicker than they actually were, triggering larger payments from the federal government. A 2026 report from the Senate Joint Economic Committee found that this systematic inflation of risk scores resulted in the federal government overpaying private insurers by an estimated $84 billion. That $84 billion surplus is exactly what funded the free perks like dental, vision, and gym memberships. Insurers used these overpayments as a marketing tool to lure millions of seniors into their plans. But for 2026, regulators began tightening the system, effectively turning off the tap on those inflated overpayments. Simultaneously, the Inflation Reduction Act shifted more of the cost for prescription drugs onto the insurers, all while baseline medical inflation began rising faster than the government's standard payments. This chart shows the medical loss ratio rule, which dictates that insurers must spend at least 85% of their revenue directly on patient care. That leaves a narrow 15% buffer to cover their overhead and their profit. As medical costs rose and overpayments disappeared, that 85% segment expanded, crushing the insurer's 15% margin. With their profits vanishing, insurers are now forced to make a choice. Since they cannot legally operate at a loss, insurers are either stripping away the extra perks to save money, or they are canceling the plans entirely and walking away from the market. Insurers disclose these benefit cuts through a document called the Annual Notice of Change, which is mailed to members every October. This is a 28-page legal disclosure designed for regulatory compliance. Because the plan name usually stays the same, most seniors assume their coverage is unchanged and never read the fine print. For those on a fixed income, these changes are mathematically devastating. In 2026, the Social Security cost of living raise was just 2.8%, while Medicare Part B premiums rose nearly 10%. The system is shifting the cost of its financial realignment directly onto the seniors. This entire model relies on your habit. Insurers profit when you assume continuity because it allows them to reduce your benefits without you ever shopping for a better alternative. If your specific plan is one of the hundreds being terminated, you have a unique opportunity called guaranteed issue rights. This gives you the legal right to move back to original Medicare and buy a Medigap Supplement plan without any medical questions or underwriting. You are guaranteed the same price as someone in perfect health, but this window is unforgiving. If your plan is ending, you must select your new coverage between October 15th and December 31st. If you miss that deadline, you could enter the new year with no prescription coverage and no limit on your out-of-pocket costs. For everyone else, the strategy for 2026 is to treat the October mailing as a new contract. You have to hunt through that document for changes to your dental, vision, and drug tiers to ensure the plan you have is still the plan you need. The 2026 reset means that assuming your coverage is safe is no longer a viable strategy. Protecting your health and your budget now requires verifying your benefits every single October.